Come on in. So here we got our front desk. Right, we've got our sign-in kiosk right here for patients so that we have the most accurate subjective information for when you come in as a patient. Right, we want to know exactly what you've got going on from your words, not my interpretation of your words, but we get your words in here, see how you're doing, and we keep track of that every single visit, so we're nice and accurate. All right, Emily's usually here. She checks you in. Up here we've got our information slides, right? Our health and or our pillars of health slides. We've got all those on our website as well. But those are for patients to check out as they're here. We've got our products such as our CBD clinic up there, and then our turnstile here of the products we offer in the office, right? And then behind me here, we've got our conditions wall with all the conditions that we treat as chiropractors, right? We got brochures about all of that. So a lot of patients actually will come in themselves for, say, something like low back pain, and then they'll see a brochure that has something going on similar to a loved one or a family member, and they'll go ahead and grab it and they can give it to their family member at home. And it really helps share all of the things that we can really do as chiropractors, right? We're more than just back pain and neck pain. We can help with a whole bunch of other things, especially with our patient education. All right, so follow me over here and I'll show you. This is where we usually take patients in from the waiting area right here, right? In through here is the treatment room. We'll go in there in a minute, but right here is the exam room. This is where you start out. You end up coming in here. Emily brings you in. You can have a seat here, and we just have you in here do your intake form. You can either do it online when you come or before you come, or you can do it in here with Emily. All right? I'll typically then come in here, and we talk. We get to know each other and see what you got going on, what your expectations are and your goals. All right? Right behind me, we've got our exam table and our X-ray machine, right? So that if we need to, if we feel that's warranted, we'll actually discuss potentially taking X-rays of what you've got going on, right? Say you come in with back pain and you're of a certain age and you have a past history. We want to make sure that we rule out any sort of severe things going on inside. We can always X-ray them here. We send out every single X-ray we take to our own personal radiologist, all right? So they give us a nice printout and a radiology report of a professional radiologist that evaluates the X-ray for anything that I may have missed. I mean, as a chiropractor, we're trained to evaluate and do radiologist reports ourselves, but I feel it's safe and best practice to have a radiologist check it as well. All right, so let's head over to the treatment room. In the treatment room, this is where the chiropractic table is, and this is where we perform all of our chiropractic treatment. All right, so here we can adjust the spine, whether it be with our hands or with my activator treatment, and we work on mobilizing particular restricted areas to improve your health, right? We can use our soft tissue tools such as our Grassin tools to improve that mobility. We also have dry needling to help increase that mobility and decrease muscle tension, and then our table gets a little longer and bends down to the ground to provide our flexion distraction technique to help with disc stuff such as sciatic symptoms or disc herniations. You can read about more of those on our website under our services section there. All right, so got all my reading right there that I like to do, some of my favorite books, and then our reminder of how important the pillars of health are right here. So we put those up just so that we're able to discuss, if patients want, we end up discussing particular pillars of health, all right, and what they can do. Similar to what we've got on our website as well, under the Newman Experience portion of the website. All right? We usually let patients out this way here because Emily is right around the corner. All right? So she'll check you out and set you up for your next appointment. Hope to see you soon.